Okay, let's unpack this. Imagine you're a young person. You're navigating all the complexities of growing up, right? And then maybe a mental health challenge surfaces.
Hmm.
You decide, bravely, to seek help only to, well, hit a wall. You find long wait times, services that are miles away, or maybe just that really uncomfortable feeling of walking into a clinic. A critical struggle so many face.
Yeah, it really is.
And the numbers in Australia, they tell a stark story. 1 in 5 young people aged 16 to 24 grapple with a mental health disorder each year.
1 in 5. That's huge.
It is. Yet only about a quarter of them actually get professional help, and even fewer receive, timely evidence-based care.
What's truly fascinating here, though, is how the very tools that are already so central to young people's lives, the internet, technology, are now becoming a really promising path to overcome these traditional barriers.
Right.
The potential to provide support, improve mental health, foster well-being, anytime, anywhere, it feels immense.
Absolutely. And that's exactly what we're diving into today. We're taking a deep dive into a powerful study. It's called Developing a Mental Health eClinic to Improve Access to and Quality of Mental Health Care for Young People, using participatory design as research methodologies.
Okay.
Our mission. To really understand how researchers in Australia built this new kind of online mental health clinic, not for young people, but crucially, with them, and what that whole approach means for the future of care.
Building it with them, that's the key phrase, I think.
Exactly. So why is this such a pressing issue? When we zoom in, the scale of the problem becomes, well, painfully clear. Beyond just those overall numbers, there are layers of barriers, geographical limitations, right, which leave people in regional, rural, remote areas feeling really isolated.
Definitely. Access is a massive problem out there.
Then there are economical hurdles too, meaning cost can be a major block. Human resource limitations, there are often just not enough qualified professionals to meet the demand.
Yeah, the workforce issue is real.
And then there's that enduring kind of insidious issue of stigma, which can make young people really hesitant to seek help face to face.
That's a big one still.
Yeah. And these challenges, they hit particularly hard among vulnerable populations. Disadvantaged youth, Aboriginal and Torres Strait Islander young people, those from culturally and linguistically diverse backgrounds. It's a massive, urgent gap in care.
Building on that, it really makes you wonder, how do we actually bridge this gap between the urgent need and the available access?
Right.
The paper highlights that for years, technology, especially the internet, has been seen as a potential game changer. And it's not just about providing information anymore, but offering, broad mental health promotion, screening, early intervention, even delivering sophisticated stepped care services where treatment intensity adapts as needs change.
Step care. Okay.
And the timing couldn't be better, really. Young people are digital natives. In Australia, for instance, 99% of 15 to 17-year-olds were internet users, almost a decade ago now?
Wow, 99%.
Yeah. They're already online, they're seeking health information, often finding it helpful, and crucially, experiencing less stigma and maybe more anonymity when engaging with health tools digitally. This existing digital fluency, it offers a powerful foundation to build on.
Okay, here's where it gets really interesting, I think. The researchers didn't just, sit in a room and decide what young people needed. They actually invited them to the design table.
Right.
Like we said, they didn't build this eClinic for young people, they built it with them. This brings us to a concept called participatory design, or PD.
The PD, okay, I've heard of this.
Yeah, it was developed way back in the late 1960s, early 70s. And PD is all about involving everyone who has a stake, the end users, the developers, the researchers throughout the entire product development process.
So everyone's in the room from the start.
Pretty much. The core goals are crystal clear. Make sure the product truly meets everyone's needs, make it genuinely usable, and significantly increase user engagement. It's about, shared responsibility, not just asking for feedback right at the end.
It's interesting to consider what that equal responsibility truly looks like in practice, though.
Yeah.
The study outlines an iterative research and development cycle, an R&D cycle, that was far more involved than just sending out a simple questionnaire.
Okay.
It moved through these distinct phases, starting with initial workshops, then into what they called knowledge translation sessions, basically, turning those raw workshop ideas into tangible designs, like mock-ups and wireframes. those early visual
Yeah.
blueprints.
Like sketches of the screens.
Exactly. And that was followed by rapid prototyping, building quick versions, and finally one-on-one consultations with new users to assess the usability of the alpha build that's like an early functional version of the software.
So testing it out with fresh eyes.
Precisely. The workshops themselves were quite involved. 4 workshops with 28 end users, that's 18 young people and 10 youth health professionals, along with 8 researchers.
Wow, quite a group.
Yeah, held in Sydney, sometimes separate groups, sometimes combined. And importantly, a mental health professional was always on site for the young people's workshops, offering support if, any sensitive topics caused distress.
That's crucial.
Oh, absolutely. And a neat detail, they used no technology during these initial workshops. It was all about physical artifacts, like hand-drawn sketches to really get the creativity and discussion flowing.
Old school. I like it.
Yeah. Then after each workshop, that knowledge translation phase took observations, tallied them up, and refined the designs based on recurring themes.
Mhm.
Then for the one-on-one consultations, they brought in 6 new end users, 4 young people, 2 professionals. These participants assessed the alpha build using a think aloud protocol.
Think aloud. So they just say what they're thinking as they use it.
Exactly. They narrate their thoughts as they navigate the system. They had specific tasks like creating an account, finding the crucial Need Help Now button, booking an appointment, things like that.
Got it. So after all that really intensive co-design, what did this mental health clinic, the MHeC, actually look like in its alpha build? What came out of it?
Well, the iterative R&D cycle, it revealed 5 crucial components that became its backbone. And these were really user-driven breakthroughs shaped directly by all that feedback.
Okay, let's walk through them. What's first?
First up, the homepage and triage. Young people, they wanted it to be welcoming, comfortable, yet still professional.
Right, a balance.
Exactly. So the design included elements like testimonials from other young people, reliable mental health info, tips on how to help a friend, FAQs, a clear explanation of the MHeC.
And crucially, I remember reading this, all of that had to be accessible without needing to log in, right?
Absolutely critical, low barrier to entry. But here's maybe the most critical unanimous request from both the young people and the professionals. A clearly visible Need Help Now button for crisis support.
Right there on the homepage.
Right there, before any login. It speaks volumes about the priority of immediate, no barrier access in a crisis.
Yeah, absolutely vital. Okay, what's next?
Next, the online physical and mental health assessment. Users were, maybe surprisingly, quite comfortable with online assessments,
Yes.
and they absolutely craved immediate feedback. Now, initially, their preference was for shorter questionnaires, maybe 15 minutes.
Makes sense, attention spans and all that.
Yeah, but once it was explained that a really comprehensive assessment, maybe up to an hour, was necessary for a detailed dashboard and a truly personalized plan, they understood.
Oh,
But that led to another key feature.
Huh.
A pause and resume later button became absolutely vital for those longer forms, a really practical demand.
totally. You get interrupted, life happens.
Exactly. They also preferred specific question types like Kurt scale, the rate your agreement ones.
Sure, strongly agree to strongly disagree.
Right. 2-way close-ended questions like yes, no, and multiple choice. They weren't keen on lengthy free response text boxes.
Easier to process, I guess.
Yeah,
Both for them and the system.
probably. And the assessment itself covers medical history, physical health, mental health symptoms, and health behaviors. Pretty comprehensive.
Okay. Component in 3.
Then there's the dashboard of results and progress. Immediate feedback after the assessment was described as essential, highly motivating,
They wanted to see the results right away.
instantly. And they wanted results presented in a detailed visual concept using simple bar graphs, colored icons, maybe traffic light representations for easy understanding, a quick intuitive read.
Visuals are key.
Definitely. Line graphs were preferred for tracking progress over time. They also wanted the option to print or save results as a PDF or to share them.
Mm-hmm.
And a really clever suggestion that speaks to deeper engagement. A customize option, allowing individuals to select multiple variables of interest to sort of explore how they might influence each other.
Interesting. So they could play around with the data a bit.
Yeah, make it their own.
Okay, number 4.
The fourth component is the waiting room, booking system, and video visit system. Users requested a straightforward booking system for timely appointments, obviously.
Standard stuff.
Right. But they also envisioned a waiting room within the MHeC itself. a place where they can maybe do breathing exercises or watch selected videos while waiting for their video visit to begin.
Oh, that's thoughtful. Like a digital waiting room experience.
Exactly. And here's a truly surprising detail, I thought. Some young people specifically wanted the option to hide their own image during video visits.
Really? Why?
They explained that seeing myself distracts me, which I kind of get sometimes.
Yeah, I know what they mean. Sometimes I wish I could do that on calls when I haven't had enough coffee yet.
All right. They also suggested a chat box for sensitive topics or if, the connection got glitchy. Everyone agreed the video system needed to be embedded within the MHeC for security.
Good point. Not
Yeah.
linking out somewhere else.
Yeah. And a share functionality was important, allowing professionals to, say, share the young person's dashboard directly onto their screen during a session.
Makes sense for discussing progress.
Okay.
And the final piece.
Finally, the personalized well-being plan. This plan would be generated directly from their assessment results, offering tailored automatic recommendations on how to improve their health and well-being.
So, actionable advice based on their data.
Exactly. Young people particularly valued links to evidence-based and health professional recommended apps and e-tools, with a strong, resounding preference for free ones.
Ah, yes. The free part is usually popular.
Always. Key areas of interest for these tools included help with sleep, improving memory, mood tracking, and progress tracking over time. The vision was for these apps, maybe even wearable devices, to be integrated with the MHeC.
Integrated. Wow.
Yeah, and participants suggested that apps should be sorted by categories sleep, mood, anxiety, physical health, with direct links to the Apple Store and Google Play for easy download.
Streamlining access to other helpful tools.
Precisely.
What's particularly compelling about all this, listening to you describe it, is how much richer and, well, more effective a tool becomes when you truly listen to those nuances of user experience.
Absolutely.
Like the desire for a pause button or the option to hide your own video feed. These aren't huge technical hurdles, but they make a massive difference to usability and comfort.
Exactly. It moves beyond just functionality to genuine usability and comfort, fostering a sense of ownership and trust in the system itself. These small human-centric details, often overlooked in, top-down design, they truly refine the design into something far more impactful and sustainable.
Yeah. So this deep dive wasn't just about the what in terms of functions, but also the how the MHeC would actually feel to use, and crucially, how it would handle intensely sensitive information. Let's talk about that user experience.
Okay.
The user interface, the look and feel. What do they want there?
Well, young people and professionals alike wanted the system to be clean and tidy, displaying short, concise info, making good use of space.
Less clutter.
Right. They preferred icons over text sometimes and wanted to self-explore the system rather than being bogged down by lengthy instructions.
Let them figure it out.
Yeah. Interestingly, the use of stereotyped photos, like generic happy or sad people, was highly discouraged. They wanted authentic, relatable visuals.
Good call. That stuff often feels really fake.
Doesn't it? They asked for videos about how to use the system, but emphasized they should be short, no more than 30 seconds and not autoplay.
Oh, yeah. Autoplay videos are the worst,
Yeah.
especially with data concerns or if you're in public.
Exactly. Preferred background colors were soothing, like blue, with brighter colors, maybe like orange for functional elements, buttons and things. They even suggested a customizing option to choose between a few text types and background colors.
Giving them control again.
Yeah, personalization was a recurring theme.
Okay, and the big one, privacy and data sharing. That was a huge discussion.
Oh, absolutely. It was a significant concern, especially among young males. They were particularly worried about confidentiality and location sharing. You heard phrases like, sharing data is okay, but it must say it's confidential. Now, while young females also had concerns, they reported maybe fewer specific privacy anxieties if the data was clearly going to a clinician.
Interesting difference there.
Yeah. However, all young people indicated they would share their data if the site felt professional and trustworthy. They believed it would enable them to get most help.
So a trade-off they were willing to make if trust was there.
Exactly. But they demanded clear information on how their data would be handled before giving permission, and crucially, the option to withdraw that permission at any time. Non-negotiable.
Total transparency and control. Makes sense. What about integration with social networks? How did that land?
It was mixed. Young people wanted the ability to share the MEC maybe on their profile or via private message to a friend. They also wanted to like the MEC or leave comments.
Okay.
A particularly valued feature was the concept of tips displayed throughout the MEC, which they also wanted to be able to share via their social networks, seeing it as a way to support their peers.
Sharing helpful content, not necessarily their personal usage.
Precisely. That distinction was important.
So what's fascinating then is how these preferences played out during the actual usability testing. Did the design hold up?
It seems like it did, largely. Creating an account and logging in was found to be simple for everyone. Now, about half of the participants liked the idea of social media login for speed. They called it super easy.
Quick and convenient.
But the other half firmly rejected it, citing significant privacy concerns. They explicitly said things like, "I don't want my friends seeing this information."
Right. That stark divide really highlights the tension, doesn't it, between convenience and the deeply personal nature of mental health.
Absolutely. It shows there's probably no one-size-fits-all answer for login methods. And remember that critical need help now button we discussed.
Yeah, the crisis button.
All participants in the usability test found it in less than 5 seconds.
Wow. Less than 5 seconds. That speaks volumes about the clarity and effectiveness of that specific design choice. That's a powerful indicator of success. So what does this all mean then for the effectiveness of this whole rigorous user-centered design process?
Well, this MHeC conceived through this really rigorous participatory process, it seems truly a first of its kind. It comprehensively integrates triage, online assessments, immediate feedback dashboards, video visits, and personalized well-being plans into one seamless system.
It's much more sophisticated than just basic telemedicine then.
Oh, absolutely. Far more technologically advanced. Traditional telemedicine often just replaces isolated parts of the care process, like swapping an in-person visit for a video call. The MHeC isn't just a Band-Aid, it's like a new architecture for care.
The whole system.
Exactly. And one of its key strengths is how it blends these new and emerging technologies with the essential role of human health professionals. That human element is still vital.
Right, especially for young people maybe with low health literacy or those in crisis who might struggle with purely automated systems.
Precisely. This blended approach helps ensure no one falls through the cracks.
Looking at this from a broader perspective then, this work seems to align perfectly with those national calls we hear about for an overhaul of mental health services, especially in Australia.
It really does. Those calls emphasize person-centered design and the critical need to integrate e-mental health solutions with traditional face-to-face services.
So the MHeC has potential to dramatically improve access, particularly for those in regional and remote areas where services are scarce.
That's the hope. Huge potential there. And its success, this initial work, is already informing a larger modular platform called the Synergy Online System.
Synergy. Okay, what's that?
Synergy aims to link integrated, interoperable resources, meaning they can easily talk to each other, share information.
So systems working together.
Yes. Things like apps and e-tools complementing existing health providers and tracking real-time health and social outcomes. It's a big initiative, backed by a substantial Australian government investment at $30 million.
$30 million. Okay, so they're serious about this direction.
Very serious. However, it's important to acknowledge, as the paper itself does, that the sample size for the Alpha Build's usability testing was, on the lower end.
Right.
Which means further research and real-world validation are definitely needed to fully understand its long-term acceptability and usability across broader populations. That's the next critical step.
Of course. Always more research needed. But what a journey from identifying this critical gap in youth mental health care to meticulously co-designing an innovative eClinic. This deep dive really shows how truly putting the user at the center, listening to their every nuanced need, can not only create more effective tools, but can also bridge significant gaps in access and quality of care. It could really transform how young people engage with mental health support.
Absolutely. The takeaway seems clear. When you build with the user, you build solutions that truly matter.
This deep dive into the MHeC really makes you think about the sheer power of involving people directly in creating the solutions they'll use, doesn't it?
It really does.
It's such a powerful reminder that the best tools aren't just built for us, but truly with us.
Which raises an important question, perhaps, for you to ponder. If we can harness technology and this kind of participatory design to revolutionize mental health care for youth, What other critical societal challenges could be addressed more effectively by truly empowering the end users in their design and implementation?
That's a great question to leave things on. Thank you for joining us on this deep dive. We hope this exploration has given you a shortcut to being well-informed and perhaps spark some new ideas for your own world.